Hello, my name is Rosanna Brunhart. My article is titled Project Grace, a staged approach to the development of a community academic partnership to address HIV in rural African American communities. It was published in March of 2011 and it was written by Smith, Adormora, Humans, Muhammad, Blumenthal, and Ellison. Why I chose this journal article was because HIV has a high mortality rate based on the transmission and its spread as being a sizable public health problem. 36% of the population lives in the South. Nearly half the people with HIV/AIDS in the U.S. reside in the South. Blacks comprise 30% of the population in the South and 50% or over of the HIV cases. Diagnosed at a later stage of the disease, HIV is a human rights issue, not only a public health issue. I located some photos to put faces to the issue, and here is a woman, a young girl, with the word "Stop AIDS" on her forehead, and "Get on board." And another photo of a coalition of women wearing HIV on their shirts showing a unified attempt to stop AIDS. The impact of HIV is a significant impact of HIV in the South, and it does vary by ethnics. 8 of the 10 states with the greatest number of new HIV diagnoses are in the South. The South is typically the area of the country comprising rural population. African Americans are considerably impacted by HIV in the South, comprising over 50% of the new cases in just 2014. Both black men and women have the highest rate of the disease, comprising the largest percent of all HIV diagnoses in the southern rural areas. This information was obtained by the CDC. Here is a diagram that shows a map of the country, and it illustrates the highlighted dark locations where the gravitation is in the South with the greatest number of cases. A diagram that shows the difference in the colors from the lightest to the darkest and shows you where the gravitation is of the highest number of cases, and they do gravitate in the southern states. Part 1. The CBPR problem. The researchers viewed HIV as being an epidemic health crisis in rural African American communities. Researchers believe the HIV epidemic in rural southern African American communities were not receiving critically needed attention. The article identified the community as both counties located in Edgecombe and Nash, and they were both rural counties in North Carolina. Both counties shared a common city called Rocky Point, and that had the highest rate of HIV. In Nash County, 82%, and in Edgecombe, 86%. Of the population of HIV/AIDS cases are African American. Issues that arise in solving this problem. The general CBPR problem that is being solved is lowering the disparities in health by developing a collaboration partnership between the academic and the community researchers in hopes of creating an intervention strategies at preventing the spread of HIV in rural southern African American communities. The authors decided to conduct the research when they did since they believed little attention was given nor an emphasis of a community academic collaboration in prevention of HIV in the rural southern African American communities. Challenges were rooted in the social context and particulars within this type of community. HIV/AIDS disproportionately affects African Americans. Black men are 8 times higher than white men to contract AIDS. Black women are 23 times higher than white women. The overall population 10 times higher than white population. This came from the CDC and comprise the entire population of the country and can be applied as an example in this article. Issues that arise in solving this problem. The prior belief was statistical rates correlated with risky personal behavior. Now HIV prevention looks at intervention strategies based on a socio-cultural environment of health disparities where higher rates are among African American communities than other ethnic groups. Problems involve stigma, which prevents testing and condom use. Problems include lack of health insurance, lack of an education, lack of employment, poverty, and isolation, especially in the rural southern states. Other researchers have done something similar to resolve the problem. There was an article I located, The 4 C's of HIV Prevention with African Americans, Crisis, Condoms, Culture, and Community. It was written by Williams, Wyatt, and Wingood. The article discussed using a collaborative partnership with a CBPR approach between community members and culturally competently trained researchers in solving the challenges of HIV spreading in the African American communities. The article discussed developing a real-world sensitive infrastructure, building community capacity within the social cultural context of the African American community, providing resources, grants, implementing interventions to prevent the spread of HIV disease. Public health programs should be aimed at meeting the needs of the cultural context within the African American community. Other researchers have done something similar with an HIV/AIDS Awareness Day. Get educated, get tested, get involved, and get treated. The benefits of HIV prevention. They include avoiding a fatal disease, avoiding pain and suffering, lessening the financial expenses in seeking appropriate treatment, eliminating stigma associated with being labeled an HIV. The benefits for the community. Stigma, lowering that. Lessening the burden of financial expenses for sponsoring treatment and rehabilitative programs. Benefits of HIV prevention for the economy is to lessen the financial burden via the medical providers, lessening the government expense in financing treatment. Aims and the goals of this article was to increase the value of the research product for both partners, the community and the academic collaborative partnership, to improve health by tackling the spread of HIV in Southern African American communities, using interventions geared with a CBPR approach that will identify individual social and physical environmental factors. Interventions were needed in Edgecombe and Nash counties of rural North Carolina, whereby the academic and community can collaborate with a common goal in preventing the spread of HIV disease, especially in the shared city of Rocky Mountain that had the highest rate of HIV. Project GRACE, that involved growing, reaching, advocating change, and empowering. Project GRACE was a staged approach with a CBPR model to create culturally sensitive, feasible, and long-term interventions in hopes of preventing the spread of HIV in southern rural African American communities. Partnership development involved 4 stages that consisted of mobilization, organizational structure, building for action, and planning for action. Mobilization. It involved a grant proposal that the university investigators held community meetings inviting key stakeholders to discuss funding a health concern in the communities impacted. HIV was identified by the community members as being their main concern. The key stakeholders, they included individual community members, representatives of local community-based organizations, health social services, and faith-based organizations. Overall, 94 members were part of this coalition. The grant writing. It encompassed a collaboration between the university investigators and community members in a partnership approach. The community outreach specialist was hired directly from the community once funding was received. Coordination was achieved connecting the community members, service providers, local leaders, and persons considered influential within both counties. Part 2, Methods. Stage 2, the organizational structure. It consisted of a steering management committee. It comprised all contracting and subcontracting partner organizations, volunteers, and community leaders within both counties as equal decision makers regarding addressing health racial disparities and all project activities. It met on a monthly and yearly basis, made hiring decisions, it reviewed data collection, it tweaked the framework regarding what the influences of HIV was regarding spreading, and based on a needs and assessment survey. The monthly meetings expanded based on an interest in the community with the creation of ex officio membership. Stage 3, Capacity Action Building. It involved a workshop conducted by Visions regarding the HIV/AIDS spreading in both counties. Vision is an African-American-owned consulting company based in North Carolina that the community members were able to identify with because it was pre-established and pre-existing. The racial, economic, and other forms are underlying causes of the environmental and contextual determinants of HIV spreading in these communities. Oppression is believed at institutional, cultural, interpersonal, and personal levels that attribute to in the spread of HIV. Part 2, Methods. Stage 4, Planning Action. Needs and assessments. Focus group interviews took place. They determined the community needs, resources, goals, and objectives in both counties. They determined what was perceived as the determinants why HIV was spreading. They also determined strategies in prevention. They targeted a choice of intervention with a strength-based initiative. Part 2, the results. Racial, economic, and other forms are underlying causes of the environmental and contextual determination of HIV spreading in these communities. Oppression is believed at the institutional, cultural, interpersonal, and personal levels that attribute in the spread of HIV. HIV stigma and isolation were main barriers in rural communities regarding participation. Overlapping social and professional networks can help as well as hinder the initiative. Community members wore many hats since they held professional roles in the community while serving on the steering committee. Comparisons, evaluation of methods. Consultants use interviews to evaluate the CBPR principles and make changes. 4 areas of evaluation. 1, knowledge of the project. Secondly, facilitators. Third, cultural differences. And 4th, empowerment. Conclusions of the author. Each stage solidified the goals of the partnership. All data collection, analysis, and interpretation was believed to have been collaborative with a partnership approach. Dissemination of the information was stated as being collaborative and reviewed by a team of steering committee members prior to any presentations or distributions. Challenges in the CBPR in tackling the spread of HIV in rural communities were addressed in a collaborative, collective manner. The authors believe they have a foundation for intervention, development, and evaluation. Part 3, the assessment of the paper. Quality of the research. Strengths. Used a pre-established community organization called Vision. Vision is an African-American-owned company based in North Carolina that the community could identify with because it was pre-existing and pre-established. It assessed barriers like stigma, race, economics, and other forms of underlying causes of the environmental and contextual determinants of HIV spreading in these communities. Certainly, there is a springboard regarding future research. The authors believe they have a foundation for the development and evaluation of causes of HIV spreading and intervention strategies to prevent the spread of HIV in these communities. Their conclusions appear consistent with other articles I read on the similar subject. Weaknesses. Qualitative data use. No real statistics were presented, nor case-specific studies shown. The employees were paid. They were not all volunteers. They seemed to be motivated by a salary incentive and grant monies. They recruited community members and had a social type monthly meeting to address their concerns regarding the spread of HIV. The key stakeholders included academic, individual community members, representatives of local community-based organizations, health, social services, and faith-based organizations. Overall, 94 members were part of the coalition, which didn't really seem that overwhelming considering the number of people involved with the spread of HIV. The consortium meetings and interviews they gathered data, but not certain whether the surveys and questionnaires were used based on contents of a brief article. Ethical considerations. Yes, the authors had a significant conflict of interest in recruiting participant members. There were ethical considerations since the recruited members might reiterate what the recruiters wanted to hear. It didn't appear free of bias nor free of influence. The authors did address an overlapping, dense, professional and social network among the participants where the same people know each other in both and can lead to some form of bias and influence. The use of the community-based participatory research principles. Based on the article, the partners agreed upon a collaborative coalition that planned on addressing the main concerns of both counties being studied, i.e. the spread of HIV. The partners appear sharing the credit for Project GRACE and creating a foundation for CBPR, however not certain whether any of the authors in the article were among the lower base community members or only academic institution researchers were the authors disseminating the project. ? However, dissemination of information was not an equal partnership. Presentations were made by the principal investigator, with subsequent discussion sessions moderated by the community members. The overall release of information was not made equally by all partners. And yes, the partnership does build on identified strengths and assets, and identifies challenges in working in rural populations. The researchers utilize a pre-existing community organization, i.e. vision. The partnership appears to attempt to balance in power among partners and enable resources among partners to be shared. The article states that a steering committee rather than a community advisory board was selected, emphasizing a need for equal partnership with collective decision-making and active participation of all members. Communication seems ongoing with monthly and annual meetings, providing an opportunity to tweak the project and continue with its agenda. However, dissemination of information again was not equal among all partners. The author appears to have used primary and secondary sources. The roles, norms, and processes for the partnership seem established. However, there was room for improvement. However, there doesn't seem to be a period agreement of all partners in the dissemination of information, since only the principal investigators speak first prior to discussion meetings with community members. There is interaction between the members at the consortium meetings, and agendas were developed from the members of the community. There is an ongoing needs assessment by the partners, the goal of continuously improving the partnership and its outcomes. The implications for CBPR and the directions for future research. The authors believe they have a foundation for development, evaluation, and intervention strategies to prevent the spread of HIV. This is a work in progress, with an ongoing needs assessment and continuous intervention strategies aimed at preventing the spread of HIV. I believe the author's methods, implementation, and evaluation, especially for CBPR content, was adequate as a beginning. Not certain whether they really accomplished all their objectives. It appears initially motivated by some form of grant funding in order to commence the work. They hired community members with salaried positions and hired vision organization. Without a constant money source that keeps the work ongoing, not certain whether the investigators or the communities will keep this relevant with a personal interest if they had to work for free. It did not appear the researchers made simplified assumptions regarding what they believed. It appeared that they made simplified assumptions regarding what they believed had been achieved. Little or no statistics regarding any accomplishments. There were no numbers concerning whether the rate of HIV infection had decreased since Project GRACE was implemented and the real impact of their work. The next steps could include seeking additional funding and grant resources, cover a greater proportion of the community, and build on prior incentives and capacities. Summary, my conclusions. No, I don't accept all the author's conclusion, mainly because grant funding or other resources have been the primary for their work to continue. There doesn't seem to be a personal investment involved. In addition, no statistics or HIV rate declines were documented based on the intervention strategies implemented. Minimum examples were shown where the consortium meetings had changed attitudes or created intervention that impacted a decline in the HIV rate transmission. Overall, Project GRACE does provide a foundation or a springboard that can develop with ongoing acceptance within the community to adopt the intervention strategies. Questions. The first question, does stigma play a sizable role in the spread of HIV, preventing needed partnership between the researchers and the community in terms of the optimal CBPR needed? Secondly, did the researchers skip or did they cover any aspects, important aspects, or essentials concerning community-based participatory research? Third, did the researchers really provide the attention the issue needed concerning HIV spreading and prevention intervention needed in African American rural North Carolina communities using a collaborative approach? These are my references.